Good afternoon, everyone. I'm Dr. Amit Shah. I've got Mr. Arasaratnam Shrikant Raja and Mr. Anil Guri, Dr. Anil Guri, sitting next to me. He obviously is the superstar of the fertility Facebook pages, as you may recollect. Now, three of us are here in Dubai at the moment, just about to complete the prestigious IBC course, which is getting into its sixth year, as you may already know. So over the last 4 days, we have conducted some extensive discussions and workshops which involve basic fertility science and advanced fertility science such as IVF, ICSI, and IUI treatments. Dr. Shri, who is a consultant embryologist, had obviously carried out some really exciting new developments in embryology, while Dr. Guri and myself have been updating everyone about the modern trends in fertility. I will now hand over to Dr. Guri to tell us a bit more about our forthcoming adventures.
Hello, I'm Dr. Guri, and this course was probably one of the most intensive courses that we had done. Unlike conferences, we try to make this course very intensive with a lot of questions that come through, and we aim to discuss topics which often are not discussed in major conferences. Again, this is not a conference, this is a training course where we start from looking at ovulation induction protocols, looking at how we use clomiphene, how we use letrozole, the various protocols of chronic low dose protocols, and the multiple protocols of IVF. The two of the main important topics which Amit and me talk about are those of treating poor responders, looking at luteal phase stimulation and follicular phase stimulation, and also what we often call as chasing the antral follicle, of trying to stimulate at the right time. Also, the challenging issues around hypo-hypox stimulation and PCO stimulation is something which Amit and me come together to discuss and look at different ways of challenging it. There are multiple areas which are outside conference areas. And again, this is not a lecture-based 30 minutes of lecture, while it is very much I would say a combative and yet a plan of, what would you call it, Amit?
It's a very one-on-one intensive teaching program. It is about your day-to-day practical problems that one faces in clinical practice. So you can read your theoretical knowledges from any textbooks and journals, but the important part, I think, is that how we troubleshoot and what happens when everything fails and how we approach those cases, and that is what we focus on. Thank you, Anil, and I'll now hand over to Shri to tell us a little bit about what he has done over the last 2 days with regards to embryology. Shri.
My name is Sri Kadraj. I'm a scientist or embryologist working in Homerton. So I know that you all are clinicians or fertility doctors. So what am I doing here? Because we feel that all fertility doctors should have a basic knowledge in embryology or what happens in the lab. So I'm here to do some lectures on andrology, that is semen analysis and sperm preparation for various treatments like IUI, IVF, ICSI. And then I'll do the basic embryology, what happens in the lab from egg collection throughout the embryo culture, embryo transfer, embryo freezing, mainly vitrification. I'll give a lecture on that. And also I'll talk about time-lapse technology, which is current development in IVF. So I'll go into detail about time-lapse technology, and also I'll finish with quality control measures in the lab and how can we improve our success rate by keeping the lab conditions optimum. So see you there.
Thank you very much, Shri.
Shri, do you think that as clinicians and across many places, don't you think that as doctors, we need to understand more of being able to counsel patients about embryo quality and understanding embryo quality, because I think it's very essential that doctors know what they are when they're putting back embryos or when they do
Yes.
IUI.
Yes, especially these days, that background knowledge is very important because patients are getting a lot of information from internet, and they will be asking questions. So every doctor, fertility doctor, should know the basics and embryo gradings and embryo quality to discuss, and also to decide how many embryos to put back. All that is, it's an essential part for every doctor.
Yeah, absolutely. And if I may add a little bit more before we end this little discussion, is that one of the unique features of this training program is the practical aspects where IBC in Dubai have invested immensely into developing the models for egg collections, which involve software, and they are near life, very real experience of how we do egg collection. It's actually even tougher than your real egg time collections, which means that you learn how to be careful, how to be cautious, how to be gentle, but how to be effective at egg collection. It also involves an embryology workshop where Dr. Shri teaches everyone how to load the embryos, how to effectively prepare a catheter, which then gets handed over to clinicians like Dr. Goody and myself, where we go through the intricacies of day-to-day practical aspects of embryo transfers rather than just the theoretical knowledge. So I think overall this is an amazing program, and I wish that if I was a student, I would certainly want to come in and have a look at these programs. And even if I'm a practicing gynecologist or reproductive medicine specialist, you would definitely get a lot out of this program. So hopefully we look forward to seeing you in our next program, which is going to be back in Dubai in February 2018. Please look out for the dates at the ibcme.com website, and also look at the fertility courses which Dr. Goody very proficiently runs, where we try to address all your troubleshooting and daily courses. So thank you very much, and we look forward to meeting you all in future. Thank you.
Thank you.